We've talked about what Part A covers, we've talked about what Part B covers, we've talked about Part C, what that covers as well. Now we're down to the final alphabet letter with Medicare, which is Medicare Part D. It's for prescription drug coverage. So remember, Part D is the drug side of Medicare. This part of Medicare will help cover most of the prescribed medications that you will take on a regular basis at home or outside of a hospital setting. The two things that Part D will typically cover is oral pills and insulin. Those are the two big things that people use the Part D drug plan for. The Part D plans are provided by private insurance companies that are actually approved and overseen by Medicare to provide someone with prescription drug coverage. See, Part D, to have a better understanding of it, is offered in two ways. So once you understand that Part D is offered in two ways, it helps you become that Medicare expert. So the first way that Medicare Part D is offered is through what's called a PDP, which is a standalone prescription drug plan. Those plans go with original Medicare A and B. They are separate and they have a separate charge. We talked about in a previous video, the Part D plans run anywhere usually between $15 to about $20 a month for a standalone prescription drug plan. The other way that you can get your prescription drug coverage through Part D is through an MAPD, which is a Medicare Advantage prescription drug plan. We talked about that in a previous video as well, that Medicare Advantage plans, most of them will include prescription drug coverage as an additional benefit to the plan. To recap, the two ways that you can get your Part D prescription coverage is this. If you have original Medicare Part A and B, you'll select a standalone prescription drug plan referred to as, you get it, a PDP. For individuals that enroll in a Medicare Advantage Part C plan that includes prescription drug coverage, you'll have what's known as an MAPD. You will not need to have separate prescription drug coverage. So let's talk about what's typically covered under Part D. So all Part D plans will typically cover both the brand name and the generic medications. However, the brand name medications will cost someone more out of pocket. So whenever possible, it's recommended the most cost-effective way for someone to get their prescriptions is through a generic version. So Part D plans must cover an extensive list of prescriptions that are commonly taken by those that are on Medicare. So each plan will have what's called a formulary, which we'll talk about later when we talk about Part D, that will show all the prescription drugs that are covered on that plan. So most of the time the individual will find their prescriptions on that formulary list. If not, there will be a very similar medication that actually can be prescribed for that situation. So Part D companies, remember, are required to provide at least 2 drugs minimum to each of the commonly prescribed drug categories. So if a prescribed medication is not on that formulary and there's not a generic version or equivalent, someone can request an exception for that medication since there's nothing else that they can take that is an equivalent. So if you run into a situation like that, please reach out to us here at Healthcare Solutions Direct. We have our client experience group that'll help walk you through exactly what you need to do in order to get you exactly what you need for your prescription drug coverage.